I want to bring in Dr. Rajiv Shah. He's the head of the USAID. He's also, I think, fair to say, the new man in charge of the United States Ebola response. Welcome back to the program, Raj.
Thank you, Sanjay. Thanks for having me.
Let me just start off by asking a broader question. What is the United States obligation in something like this, and how and when does that get determined?
The United States obligation is actually quite clear. It's to mount and to help support an international effort to help our Liberian colleagues get over this Ebola crisis. And Dr. Frieden is exactly right to point out, with 3,500 cases and 1,900 deaths, this is an urgent epidemic that demands an urgent and at-scale response. And we have a clear strategy that we're pursuing together with international partners to make sure that that happens.
I was there in April in Guinea, near where this all started, and even and that was just a few weeks after the first diagnosed cases. Even within that time, about a week, 10 days, the case rate tripled at that time. MSF, Doctors Without Borders, at that time, several months ago, were saying this is already out of control. They couldn't keep up. They couldn't follow contacts, for example, to try and prevent the outbreak from spreading. Are we late? I mean, what happened here, Raj? So many times in the past we've been able to control this. Did something get missed?
Well, two things. First, since March, we've had nearly 100 U.S. personnel, including experts from the Centers for Disease Control, disaster responders, on the ground helping countries in West Africa. We've in fact delivered more than 100,000 personal protective equipment kits, trained providers on how to use them, more than doubled the laboratory and diagnostic capacity on the ground, which is where a lot of this data comes from. But it is essential to understand the context. And in an environment where there effectively is not a proper functioning higher order healthcare system, there simply has not been nearly enough treatment available for people with Ebola, which is why we're now pursuing a strategy of getting 1,000 beds set up in Liberia to treat patients with Ebola. And yesterday we noted an increase of our investment of $75 million additional dollars to help make sure that is a well-resourced, at-scale, and effective response. You mentioned some of the specifics, the dollar amount, the number of beds that will be created as a result of that. What about the infrastructure overall? These problems that you describe are not going to go away, right? This is a response to an outbreak right now. We know there's another outbreak happening in Congo, a different strain of Ebola. These happen all the time. Why won't each outbreak in the future be like this now? Is this the way outbreaks are going to be? This should not be the way outbreaks are going to be handled. In fact, that's why we're putting in place a strategy that will tamp this down in West Africa. The strategy has three essential components. One is quickly scale up treatment, 1,000 beds, including getting critical care personnel to go to Liberia to be part of the response. If there are critical care personnel that want to volunteer or be part of this effort, they can go to usaid.gov and register, and we're going to ensure that they have higher order medical care available in Liberia and access to medical evacuation should that be necessary. Second, there will be and is a strong prevention approach. So we've already delivered 5,000 WHO certified body bags, but we're training teams throughout Liberia to conduct safe and dignified burial, because so much of the transmission is happening when they're handling bodies of the deceased. And third, we're working on the broader societal issues. For example, we've already delivered tons of food items to families of affected communities and to the hospitals themselves, so patients get adequate food.
Dr. Raj Shah, thank you so much for joining us. I should point out that I get to call him Raj. We've known each other since we were kids, and I'm a bit older than he is as well. So thank you very much for joining us.
Thank you.
Thank you.